everyone, Christie Tippett from Campus Rec here. As promised, this week we are going over our shoulders. So the three main muscles that we're going to be discussing today include our deltoids, our rhomboids, and our trapezius muscles. So we're going to start with those deltoids, and your deltoids are actually made up of three major muscles, which include your anterior deltoid, your medial deltoid, and your posterior deltoid. So once again, you guys remember these terms. Anterior means the front side of that muscle group of the deltoid, and your anterior deltoid originates on the anterior lateral third of your clavicle. So anterior front side, lateral outer portion of your clavicle. So right up here. Right? The medial deltoid originates on the acromion process of your scapula, whereas your posterior deltoid originates on the spine of your scapula. And what's cool about all of your delts is that they all insert into the deltoid tuberosity of your humerus. So if you remember, your humerus is this upper arm, and all three insert into, once again, your deltoid tuberosity of your humerus. The main actions of your deltoids include, for the anterior is shoulder flexion, in addition to internal rotation, because remember it's on the front side. As we shift to the medial deltoid, it's shoulder abduction, so moving that arm away from your body. Abduction means away. And then last but not least, we have our posterior, and as you can imagine, seeing as anterior was internal rotation, your posterior delt assists with external rotation, pulling this wrist backwards, squeezing that posterior delt, and in addition to shoulder extension as well. So a lot of people don't realize how many muscles are actually within their shoulders. More specifically, your rotator cuff, such as your teres minor, your infraspinatus, your subscapularis, and your supraspinatus. So while your rotator cuff has all of these muscles, the muscles that I really want to talk about outside of your delts, once again, include your rhomboids and your traps. So while some individuals may consider your rhomboids and traps kind of upper back because they are technically located on your upper back, the primary function of these muscles have so much to do with your shoulders. So that is why we're adding your rhomboids and traps actually into this shoulder video. So your traps have three muscles as well, similar to the delts, and it includes your lower trap, your middle trap, and your upper trap. And a lot of individuals don't realize how large or how much surface area your traps actually take up, but I'm about to tell you how that works. So your lower trap originates on the spinous processes T6 through T12. So remember, T stands for thoracic, your spine. Your middle trap originates on the spinous processes T1 through T5. So once again, thoracic. And then your upper trap originates on the external occipital protuberance of the skull. Fancy words, I understand that. And your spinous processes of C7. So that's your cervical spine, which is way up high, okay? So once again, your trap muscles originate in a pretty large surface area on that upper back there. And then your lower trap inserts on the spine of the scapula. Your middle one inserts into the acromion process of your scapula. And then in addition to your superior aspect of the spine of the scapula, and then last but not least, your upper trap inserts into the lateral third of your clavicle, in addition to the acromion process of your scapula. So once again, scapula meaning shoulder blade. The main action of your trap includes scapular depression, scapular elevation, and then scapular retraction. And you'll recall we talked about scapular protraction and retraction. Retraction meaning pulling those shoulders backwards, right? Squeezing those shoulder blades together. And last but not least, as promised, are rhomboids, right? So there are two muscles in our rhomboids, which include our major and minor, okay? Your rhomboid major originates on the spinous processes of C7 through T5, so your cervical spine through your thoracic, and then your rhomboid minor originates on C7 through T1. So once again, towards the bottom part of that cervical spine and the very beginning of your thoracic spine. And then the rhomboid major inserts onto the medial border of the scapula, so that internal border of the scapula, and then your minor inserts on the medial border of the scapula of the spine, okay? The main actions of your rhomboids include scapular retraction once again and downward rotation as well. Some common exercises for your shoulders include lateral and front raises, right? We're all familiar with those exercises, in addition to a shoulder press, to a military press, to a push press, many presses, in addition to an Arnold press, right? But other kind of exercises to work your shoulders include internal and external rotation exercises. You can use a dumbbell or a cable pulley, whatever you're most comfortable with. Planking with doing a shoulder breakdown or shoulder tap, in addition to a shoulder push-up, a rear delt fly, and then my personal 2 favorite shoulder exercises include a face pull and a high pull. So those are some fun little shoulder exercises that you can do. And then some stretches include a typical shoulder stretch, sitting up straight, bringing that arm across, keeping our shoulder down and relaxed. A lot of people tend to hunch up, but keeping it down and relaxed, we feel this in our delts. In addition to a wall stretch, so walking up to, I always use this imaginary wall, walking up to the wall and then very gently turning away. That stretches your anterior delts very nicely. You can do a doorway stretch. We talked about that for the chest stretch, but walking into a doorway and then pushing that chest forward, you'll feel it in your anterior delts. In addition to, for example, intertwining your fingers behind your back and stretching it out once more. And then last but not least, there is the seated trap and rhomboid stretch. So I love to do this stretch when, you know, when you sleep on your neck wrong and you have that crick that you can't get rid of. I love to either do a little SMR, self-myofascial release, with a tennis ball, or I do this stretch. And this stretch is awesome. All you're gonna do is turn to that left-hand side. Your right arm is gonna come behind your lower back, and then you're gonna turn your head to the left side, right at a 45-degree angle. Once you're there, I want you to look down ever so gently, and then take your left arm on top of that head, and then deepen that stretch just a tad bit. Once you're here, you should feel this stretch all along your traps, a little bit in your rhomboids, and once again, this is a wonderful stretch for when you wake up and you have that little crick in your neck that you want to stretch out and get rid of. So that is all I have for this week. Thank you all so much for joining me to learn a little bit more about our shoulders and all of the muscles involved in our shoulders. As always, if at any time you have any questions or comments or certain things you would like us to cover in the upcoming weeks, please message us, let us know, and we would be happy to create a video of that. Thanks again, guys. See you next time.